Do you find yourself wincing with every step due to persistent knee pain, desperately seeking relief? Let's unveil some practical and effective strategies that can transform your discomfort into comfort, offering tangible solutions to ease that nagging knee discomfort. Hi, this is Dr. Mark Petrapoli, otherwise known as Dr. P. You got a problem with your knee? Call Dr. P. Today, I want to talk to you about a topic that affects many people, knee pain. It's huge. Tons and tons of people. I see tons of people with this. So whether you're an athlete, which I see a lot of those, or someone who simply wants to improve their quality of life, whether you're in your 50s and you've been working your whole life, or in your 60s or 70s and now you want to enjoy yourself and you can't because of your knee pain, we want to help you understand how to reduce that knee pain, and that's critical. We're going to dive into the comprehensive world of knee pain management. I'll share some valuable insights and strategies to help you manage and alleviate knee pain effectively. First of all, how to reduce knee pain. Well, number one, you need a proper diagnosis. That's the first and most important step in addressing knee pain. You have to consult with a healthcare professional who knows what they're doing and can make an accurate diagnosis. That's number one. They will conduct a thorough evaluation to determine the underlying cause of your knee pain. This is very essential because the treatment approach can vary depending on the diagnosis. Makes sense, right? We provide comprehensive diagnostic services at our office to ensure accurate and personalized care. What about medication options? Well, there's a lot of different pain relief medications out there. Depending on your condition, your doctor might prescribe different types of pain relief medications. These can range from over-the-counter options like acetaminophen, which is otherwise known as Tylenol, to more specialized medications tailored to your specific needs. You've all probably heard of NSAIDs, or nonsteroidal anti-inflammatory drugs. Your doctor can prescribe stronger NSAIDs to address inflammation and pain. They're anti-inflammatories. However, it's essential for you to be cognizant and aware of the potential side effects and follow your physician's guidance. Things like ulcers, problems with your kidney or liver, those are all things you have to be cognizant of and talk to your physician about, or your pharmacist for that matter. How about corticosteroid injections? Well, cortisone is a potent anti-inflammatory. It's one of the most potent anti-inflammatories we know of, and it can reduce swelling and pain. These injections might allow you to resume normal activities more quickly, but they're temporary, and many times they just act like a Band-Aid. However, they're also limited to a specific number of shots per year because we know from research studies, especially recent research studies, that cortisone can make the cartilage on the end of the bone, which is kind of like the tread on your tire, wear down. And when it wears down faster, that leads to arthritis, which actually gets worse over time. So people who got cortisone shots, their arthritis actually got worse over time compared to people who didn't get cortisone shots. So for that reason, we rarely use cortisone anymore. It's basically last century's technology. It's artificial and it can cause harm. How about hyaluronic acid injections, otherwise known as the quote-unquote gel injections? Hyaluronic acid injections mimic the natural joint lubrication. So we have fluid in our joints that lubricates, kind of like motor oil. And that fluid is primarily made of hyaluronic acid, and it lubricates the joints. Now, when you get arthritis, that fluid thins out. It's not as good of a lubricant as it used to be. So there's these artificial hyaluronic acid injections that can be injected into the joint, and that can improve the lubrication, and it can improve the mobility while reducing your knee pain. Now, keep in mind that the effectiveness of these injections can vary from person to person, and many studies have shown that biologic treatments such as PRP and bone marrow aspirate cells work more effectively and, more importantly, last longer. Plus, your own body makes them. They're not manufactured in a lab or in some manufacturing plant. It's your own body acting as your own medication manufacturer. So it's pretty amazing. What other innovative treatment options do we offer? Well, there's a surgery called subchondroplasty. Now, subchondroplasty is an actual brand name. I like to call it biologic internal fixation because it's a biologic procedure, and we're internally fixating. We're fixing these stress or microfractures, which are inside of the joint, or these little soft spots in the bone underneath the cartilage. And when the bone gets soft under the cartilage, that cartilage is going to wear out faster, kind of like when the undersurface of a road washes away, and then that upper layer, that asphalt's going to break down, you're going to get a pothole. So again, I like to call it biologic internal fixation, which is a precise and minimally invasive surgical procedure that I've been performing since 2014 to address joint pain and cartilage defects caused by subchondral bone defects. In other words, that underlayer of the bone tends to get soft and the cartilage over the top breaks down. That causes these defects, and they're very common in weight-bearing joint areas like the knee and the hip, even in the ankle and the foot, due to injuries, but more likely due to degenerative conditions. As we get older, we might weigh a little bit more, our muscles are weaker, and our bones aren't as strong, and so the bones start to break down faster and the body can heal itself, and you get these little stress or microfractures. Bone has millions of pressure-sensitive nerve fibers, so it hurts. Not to mention, like I said, the soft spots lead to the cartilage wearing down and the arthritis progressing faster. So the benefits of this quote-unquote subchondroplasty procedure include targeted treatment right to those lesions, quicker recovery, improved mobility. It's a customized approach because not everybody has the same lesions in the same areas or these stress or microfractures, and not everybody has the same amount of cartilage wear and tear. Also, it allows us the ability to complement other orthopedic treatments such as PRP and bone marrow cells. Since I've been performing this surgery since 2014, I believe, we've had between an 80 to 90% success rate, which depends on the severity of the arthritis. Obviously, the worse the arthritis, the less likely someone is to do well, but we've had plenty of people who've had bone-on-bone arthritis who do extremely well. Over the last several years, we've now added biologic treatments such as PRP and especially bone marrow aspirate cells to the biologic internal fixation surgery to address not just the bone, which the biologic internal fixation surgery addresses, but now we're addressing the inside of the joint, the cartilage inside of the joint. And there are some studies that show that bone marrow cells can cause some cartilage to grow back. It's not going to make your knee like when you were 18, but it can definitely improve it, and it can definitely remodel or improve the inside of your joint. We're tracking these results on our own. Now we're actually using the Data Biologics Registry, which is a national database, so that we can track our results, track your results, compare them against our own patients, and compare them against other patients throughout the country. Bridge-enhanced ACL restoration, otherwise known as BEAR surgery. BEAR surgery offers several benefits, including less painful recovery due to no need for a graft harvest. With an ACL reconstruction, we have to take a tendon from somewhere else in that knee or even the other knee or even from somebody else, and we have to make a new ligament. So that in and of itself, taking the graft, causes more pain. The BEAR surgery, you don't have to do that. We're repairing the ACL back together. So that allows for quicker and improved muscle strength and functional recovery, as well as minimize long-term effects, especially with a trend towards less incidence of arthritis long-term. So the recovery time varies, but generally allows for a return to light activities in 3 to 6 months, although some people are doing that even at 6 to 8 weeks. And then a full recovery, however, back to sports, back to full duty work, does usually take about 9 to 12 months. And even then it can take, people still improve after that. So the success rate of BEAR ACL repair is promising, and it's comparable to traditional methods, with individual factors influencing outcomes as expected. We were the first to perform an FDA-indicated non-research study BEAR surgery in the world. We specialize in BEAR surgery for sports-related injuries, specifically ACL tears, and this is with an aim to expedite healing and enhance athletes' return to activity. MLS Laser Therapy, well, what's that? Well, laser therapy involves utilizing particular light wavelengths to address painful conditions. This offers a non-surgical, non-invasive way and a safe treatment method. Different wavelengths of light can actually stimulate our cells to produce more energy, to decrease inflammation, and increase blood supply. So by leveraging the power of light, just think of photosynthesis, what the sun does, it makes you feel better. Well, it makes plants grow. Well, laser energy is just a form of light. And by leveraging specific wavelengths of light, we're able to effectively alleviate pain, diminish inflammation, and it fosters a healing and repair of the soft tissues. Platelet-rich plasma, otherwise known as PRP therapy. We have all kinds of amazing healing factors flowing throughout our blood and in our bodies. These keep us from falling apart every single day. We don't even realize it that they're working, but our bodies have amazing healing factors within them, and platelets are one of those things in our blood that have growth factors and other healing factors in them. So with PRP, we utilize one of your body's natural healing mechanisms to accelerate recovery. So we take your blood, we spin it down, and we concentrate the platelets, and that allows for a concentrated amount of growth factors to go into the area to help it heal. Recent advancements have revealed platelet-rich plasma therapy, PRP, as a promising non-surgical treatment for pain and injuries. As a matter of fact, several studies have shown It's more effective than traditional physical therapy, certain arthroscopic surgeries, and it even helps to put off or avoid knee replacement as well. As I said earlier, PRP involves concentrating platelets from your own blood to promote tissue repair and regeneration. When the body is injured, it typically forms a platelet-rich blood clot or a scab, and it releases healing proteins and growth factors to initiate repair. However, some injuries resist healing due to factors like limited blood flow or repetitive stress. PRP therapy involves injecting concentrated platelets directly into the injured area, which can accelerate the healing process by triggering the body's natural repair mechanisms. So it can help a newly injured area like an ankle sprain or a rotator cuff strain or even a hamstring tear to heal quicker and with less pain. But it can also restart the healing process in areas of the body affected by overuse stress for conditions such as tennis elbow, of which several studies have shown the effectiveness of PRP. So with tennis elbow, there's multiple studies, just like there's a ton of studies that show that PRP can help arthritis of the knee specifically. PRP can also help tennis elbow and other overuse injuries. Again, PRP can be used to treat various conditions, including rotator cuff injuries, tendinitis, tennis elbow, knee ligament injuries, and many, many more things. Just remember that studies have shown, and we know from our own experience and research, I've been doing these since 2008, that not all PRP is created equal. Dose, and especially many other factors matter, so dose matters. So make sure you contact an experienced provider like Victory in Motion and do your research and ask a lot of questions. Bone marrow aspirate cells, and otherwise known as BMAC. So what is BMAC? Well, it's an innovative medical procedure that harnesses the body's regenerative abilities to speed up healing and improve recovery. Well, how does it do that? This involves extracting a small amount of concentrated bone marrow from the patient's iliac bone. This is not the quote-unquote hip bone, okay? It's a pelvis bone, but I know that sounds a little weird. Oh, it's the pelvis, but it's an area that's relatively close to the skin. It's relatively easy, quote-unquote easy to harvest and numb the area up and obtain it. So it's really not as quote-unquote bad as people might think when they hear of bone marrow harvest or pelvis. And I have several videos on that actually have patients who are talking about how, quote, it wasn't as bad as I thought, and that is by far the most common thing that people say. In any event, we harvest this bone marrow, and BMAC itself has powerful stem cells, and it has other cells that help the stem cells in there. So this concentrated solution is then injected into specific areas of injury or degeneration, kind of like the PRP, same types of areas, same types of problems. And we know that the BMAC can effectively address various orthopedic and sports-related issues, such as joint injuries, muscle tears, tendinitis, even fractures. And it does this by promoting tissue repair, reducing inflammation, and stimulating healthy tissue growth. Remember, the cells do the work. The cells do the work. And just like not all PRP is equal, not all BMAC is equal. Once again, dose and quality matter. And for both PRP and BMAC, it should be injected under some form of visualization or guidance, such as ultrasound, live x-ray, which is also known as fluoroscopy, and or arthroscopically, minimally small poke holes. Like myself as an orthopedic surgeon, I do arthroscopic surgery with a little fiber optic scope, little small poke holes. We can put these things right where they need to go. So I do all of those types of guidance, ultrasound, fluoroscopy, and arthroscopy. And you want to make sure that you have somebody who does that type of guidance, because if they're just injecting it blindly, you're not going to get it where it needs to go. So again, we do all of these for accuracy at Victory in Motion. So there you have it. Understanding how to reduce knee pain is vital for both athletes and those looking to improve their quality of life. From proper diagnosis to innovative treatments like subchondroplasty, bear surgery, BMAC, PRP, MLS Laser, there's various options available. Remember, consulting with a healthcare professional who's experienced in these techniques like we are is the first step to personalized care. If you found this information helpful, please don't forget to like, comment, and subscribe for more valuable insights on orthopedic and sports medicine solutions. I, Dr. Mark Petrapoli of Victory in Motion, offer a wide range of services from diagnostics to innovative treatments, all in one convenient location. Stay informed and take the first step towards a pain-free life.